The information you're about to see applies equally to both men as well as women. You can see that the hair, skin, and blood vessels form quite a complex structure. This is called the hair follicle. For some who may not know, hair has its own natural cycle. It grows from the dermal papilla, which is the oval stem cells. It passes through 3 phases and it dies. Once this hair dies, another starts growing. The first phase, called the anagen phase, is actually the growing phase of the hair. While it starts growing, it pushes the old hair out. The phase continues for up to 6 years. After this, the growth of the hair slows down and changes from late anagen to the catagen phase. This catagen phase is the involuting, regressing, or dying phase. It lasts up to 6 weeks. Growth stops and the hair follicle detaches from the dermal papilla stem cells and falls. This process cuts the hair off from its blood supply and from the cells that produce new hair. After the second phase, the hair follicle enters the telogen phase, which is a resting phase of the hair follicle, lasting around 6 months. When the body is subjected to extreme stress, as much as 70% of hair can prematurely enter the telogen phase and begin to fall, causing a noticeable loss of hair. Or being no longer attached, it can appear dull. The hair cycle is controlled in every step by signals from the scalp and from the body. Some signals, the blue ones, tell the dermal papilla cells to start producing hair and grow. These signals are the growth factors, which last up to the anagen phase, telling the hair to grow. On the other hand, some other signals, the black ones, tell the hair to die and fall out. These signals tell the hair to enter the catagen phase, and it dies. This process may continue in exactly the same way for some people during their entire life. The cycle of the hair passes a 6-year anagen phase before entering for a few months in the catagen and telogen phase, where the hair falls out. There is a possibility, though, for others, while going through life changes, the cycle shortens and the hair becomes thinner. Under these circumstances, the hair goes through all 3 phases as normal, but the anagen phase becomes shorter each time. As a result, the hair starts growing slower and not as long. This process is called miniaturization, where each cycle gets weaker, shorter, and less colored until the hair can barely be seen. Although the hair follicle is not dead, it can hardly produce any hair as time passes. The big question here is, how do we maintain anagen? The only way to stop the process of miniaturization is to figure out how much time the hair spends in the anagen phase. If we succeed this, the hair will grow in a natural, healthy way.